We're here today to present findings from the 2011 Ontario Student Drug Use and Health Survey. The OSDUHS, which has been conducted every 2 years since 1977, is the longest ongoing school survey in Canada and one of the longest in the world. Alcohol still remains students' drug of choice. Over half of all students drink alcohol, and when we look at only older students in grades 11 and 12, over 3/4 drink alcohol. Driving after drinking alcohol among licensed students significantly declined between 2009 and 2011. This is the first significant decline in drinking driving in a while. Further, the current rate is markedly lower than rates evident in the late 1970s and early 1980s. Binge drinking remains elevated. Just over 1/5 of all students and 40% of 12th graders report binging on at least 5 drinks in one session during the month before the survey. This pattern of drinking is known to be related to the increased likelihood of injuries and other harms. Further, a similar proportion of students show a drinking that is hazardous or harmful in that their drinking puts them at risk for current or future physical and social problems as measured by a validated screening instrument. The trend found among males is especially interesting. Between 2009 and 2011, male students show significant declines in smoking, drinking, and cannabis use, but female students did not.
From an overall public health perspective and school perspective, I think it's really great news. And I'm particularly excited about the decrease in alcohol and cigarettes. So I'm not sure what to attribute the difference in the decreases in male substance use and the maintenance of young women's substance use to exactly. But one of the things I think about when I look back over the years, for many years, the young men used far more than the young women. And unfortunately, perhaps in efforts for gender equality, the young women over the years have caught up and have stayed at a bit of a higher level. They haven't increased, they just haven't gone down, whereas the young men are starting to come down. So the men are still ahead, I don't know if you want to call it ahead, but using a bit more than the women.